Back a number of years ago, we were looking to design and figure out what we needed to do to build the next Midwest RDH handpiece. So we brought a number of hygienists over and we had a sit-down time with them, discussions with them about what they were looking for in their next hygiene handpiece. As part of that discussion, overwhelmingly many hygienists told us their biggest concern and problem was there was irritation with the hose, and they hated having to use the hose, they hated always having to manage the hose and what happens with the hose. So they were really wanting a cordless handpiece for the ergonomic values and just the factor of getting rid of the irritation every day of having to deal with the hose. So our next step really was then trying to figure out, well, what happens when you get rid of the hose? How's that work? What's that mean? What other factors come into play? So interesting things we learned then was, battery life became a big question at that point. What kind of balance you have becomes a bigger consideration. So there were a number of factors that we then made some prototypes and tested those with the hygienists to find out really where the ergonomics came in, where they gained the benefits from the ergonomics with the right balance that helped them in their daily life. The other features we're very proud of in this handpiece, it's extremely quiet. So if you ever have patients who are disturbed by the noise level and other pieces that are happening, it's a very quiet handpiece when it runs. We're also very proud of the infection control procedures we have designed into the handpiece. It has an aluminum autoclavable outer sheath and a wipe down inner module that allows for the correct infection control.